mentioned how quickly they need to get back into their mobility, but how quickly do you think they can get back into exercise or other normal routine activities?
Yeah, okay. A lot of people ask this question.
Exactly.
If you are a desk job, you can go back to the desk job within 2 weeks.
Okay.
2 weeks. The moment switches are out, I've seen people going back to IT work within a week also. It all depends on your psyche, and there is no restriction from my side. Once the wound is fine, once the cramps are relaxed, and once you got your own confidence, you can go back to work like a desk job.
True.
But if you got a manual work which involves a lot of standing, running around, walking around, going up and down the steps, it takes minimum a month or 6 weeks to go back to work. But you gradually you can upscale your work. It doesn't mean that you have to be in the bed for 1 month and then go to the work and do everything on the same day. You can gradually upscale your work. And coming to the sports and games, we encourage them not to play high impact sports. But of course, in the Western countries, people play golf, football and everything. People even go to skiing. But of course, in Indian context, we advise them not to play football or basketball or anything. But we encourage them to play a game like a tennis or a shuttle. Those sort of games can play. Not many people ask, but some people slyly ask to the one side, sorry, when can I resume the sexual activity?
Exactly.
Okay? Sexual activity for the knee replacement, there is no restriction. Within a month, if both the partners are comfortable, they can do that. But of course, hip replacements, it takes some more time before the patient understands, because hip dislocation can happen in extreme positions. But otherwise, sexual activity has got no bearing on the recovery of the knee replacement surgery.
So
this is a common question asked in the West, but in our country it's a bit taboo.
It's a hush-hush question.
Hush-hush question. So sometimes after the wife goes out, the husband comes back and asks me, sir. The moment he comes back to me without his wife, I know that question is coming. But that's an important part. It is like any other thing.
What do you think about driving and riding?
Driving, you can go within a month's time. No issues. I would advise the patients to go with an automatic car because that gives enormous leverage to the legs. You can move around and do that. And automatic, especially in a city or metro like Hyderabad, where the traffic is bumper to bumper, it's always better to have a gearless automatic car so that one leg is at least free.
Yeah, that's a good recommendation.